The Department of Veterans Affairs, VA, is descending into chaos under the weight of sweeping reforms imposed by the Trump administration and driven by Elon Musk's Department of Government Efficiency, DOGE. What was once a fragile but functioning mental health system for veterans is now being torn apart by reckless policies that show little regard for patient care, ethical standards, or even basic logistical feasibility. The forced return of thousands of mental health clinicians to physical office spaces, the abrupt layoffs of critical support staff, and the deliberate dismantling of remote care programs are already producing disastrous consequences for a population that is uniquely vulnerable to suicide, homelessness, and chronic psychological distress. These decisions are not just administrative missteps. They are a full-scale assault on the VA's ability to fulfill its most fundamental mission. The mandate requiring remote mental health providers to return to physical offices is particularly alarming. The VA pioneered telehealth long before it became a mainstream healthcare tool, specifically because it allowed veterans in rural areas and those struggling with severe mental illnesses to access care without the barriers of travel, stigma, or institutional bureaucracy. Now, under orders from the Trump administration, these providers are being forced into inadequate office spaces where privacy is an afterthought, if it exists at all. Therapists are being told to conduct sensitive, deeply personal psychotherapy sessions from open-plan offices that resemble call centers, where the sounds of other conversations, the movement of coworkers, and the general office environment make confidentiality impossible. Some have been told to invest in privacy screens and white noise machines, a laughable and wholly inadequate attempt to patch over a fundamental breach of patient trust. The consequences of this shift will be catastrophic. Mental health professionals who have spent years earning the trust of their patients, many of whom suffer from PTSD, schizophrenia, and bipolar disorder, now find themselves unable to guarantee the privacy that is essential to effective treatment. Many veterans, already suspicious of the government and hesitant to engage in mental health care, will simply stop seeking treatment rather than risk having their personal traumas overheard by a room full of strangers. Once that trust is broken, it is nearly impossible to repair, meaning these veterans may never return to treatment. The end result will be a surge in untreated mental illness, self-medication with drugs and alcohol, increased homelessness, and an even higher rate of veteran suicide, already a crisis in the United States. As if this were not enough, the administration is simultaneously gutting the VA workforce, with at least 1,900 probationary employees already laid off, and a broader plan to eliminate 80,000 VA jobs in total. Among those fired are social workers, suicide prevention coordinators, and staff who assist homeless veterans in navigating the complexities of housing programs, disability benefits, and job placement. With these cuts, the burden shifts onto the remaining staff, who are already overwhelmed, to take on even more patients with fewer resources. Suicide prevention teams, which should be expanding to meet the rising demand for mental health services, are instead being stripped down to skeleton crews, forced to triage cases in a way that will inevitably leave high-risk veterans without the help they need. The layoffs are not just administrative adjustments. They are deliberate and devastating blows to the safety net that keeps many veterans alive. A suicide prevention coordinator in California, responsible for monitoring 800,000 veterans, has seen job openings for additional social workers canceled entirely. The overwhelming caseload, combined with the added stress of knowing that mistakes could cost lives, is taking a psychological toll on the remaining workers. The same is true for those who help veterans transition from homelessness to stable housing. With support staff slashed, social workers are being asked to take on impossible caseloads, ensuring that veterans who finally had a path out of poverty and instability will now be left to fend for themselves once again. The response from the Trump administration has been dismissive at best and outright cruel at worst. VA officials insist that veterans are now at the center of everything the agency does, while simultaneously enacting policies that make it harder for veterans to access the care they desperately need. The claim that the return to office order is about improving efficiency is laughable when its immediate effect is to reduce access to care and drive experienced mental health providers to resign in frustration. If anything, this move appears designed not to improve efficiency, but to punish VA employees for the simple act of working remotely. an ideological decision that prioritizes outdated notions of workplace discipline over actual patient outcomes. Meanwhile, the veterans themselves are left feeling abandoned. Those who have spent years working with the same therapist, finally reaching a point where they can discuss the traumas of war, now fear that their care will be disrupted, or worse, terminated altogether. Many VA therapists, recognizing the ethical impossibility of continuing under these conditions, are actively searching for new jobs. The exodus of qualified professionals will not only worsen already lengthy wait times, but will ensure that many veterans are left with inexperienced or ill-equipped providers, if they are left with any providers at all. The crisis unfolding at the VA is not a natural consequence of budget constraints or logistical challenges. It is a direct result of political decisions made with little regard for the actual lives at stake. The Trump administration's aggressive push to reshape the federal government under the guise of efficiency is, in reality, a series of ideological attacks on public services that disproportionately impact the most vulnerable populations. Veterans, who have already sacrificed their mental and physical well-being in service to the country, are now being treated as collateral damage in a bureaucratic war waged by those who will never have to suffer the consequences. Unless immediate action is taken to reverse these disastrous policies, the fallout will be measured not in dollars saved, but in lives lost. The warning signs are already clear. Providers are quitting, veterans are panicking, and mental health services are crumbling under the weight of mismanagement. If these trends continue, the United States will soon find itself grappling with an even larger mental health crisis among veterans, one entirely of its own making. The government's duty to those who serve should not be a matter of political expediency, yet that is exactly what it has become. The consequences of that negligence will be devastating, and history will not be kind to those responsible.